Hello there. This is Andrew Kolsky with Stop My OCD and Anxiety Enders. Today, we have Kristen Jacobsen, who is a counselor that works with anxiety. She actually has her own YouTube channel. She goes by the Anxiety Therapist. So she talks about these issues a lot. And we have a couple things that we want to talk about, especially related to perfectionism as it relates to anxiety today. So, Kristen, why don't you introduce yourself to the audience?
Yeah. Hi. Like Andrew said, my name is Kristen Jacobsen. I'm a Chicago-based therapist. I've had my own practice for about 10 years now, but have been working in the field for roughly 20 years, and really enjoy what I do. And I'm happy to be here. So thanks for having me.
Fantastic. I think it's so important for therapists to be able to share sort of the, behind the scenes, what actually goes on as we try and work with clients so that people can get
Right.
their understanding of what's really happening. So, I always ask every guest the same question, which is, what is it that got you to get into the therapy field in the first place?
Yeah, so it's kind of a funny story. I actually went to college with the intention of being an elementary school teacher. And at Vanderbilt, where I went, you had to have a second major if you were an education major. So I decided to go with psychology, felt like it would be relevant to teaching. And then I took my abnormal psych course and I was just hooked. Like I just found it so interesting. And so ended up, I still had the major in education, but ended up sort of pivoting and really pursuing psychology, and then went on to graduate school and worked in community mental health and a couple of jails, and did some like a lot of crisis work, doing suicide assessments um, and those types of interventions, and then eventually went out on my own.
Fantastic, fantastic. So, first off, a shout out to all the teachers out there, the
Yes.
the underpaid heroes of our nation,
And
I think.
absolutely.
But without them, none of us would be where we are today. So,
Mhm.
so you get into a place where you decide to set up your own practice, and probably like most therapists, we start out, we're trying to figure out what is our specialty, where do we really feel the most comfortable, what is the client base that we speaks to us the most.
Mhm.
So obviously eventually you got into this anxiety area, but what got you into that?
Yeah, I actually started my practice exclusively working with kids and teens because that was my background. I my youngest was 4, my youngest client, and then up through like early 20s when I was doing working in community mental health. Um, and then I started getting like these 20 something clients with high anxiety or anxiety and some depression, and found that a lot of them were just had these very sort of perfectionistic tendencies, were very high functioning, and anybody looking at them would think that they had it all together, that life was good, that um, presented as being very high functioning, but internally they were just kind of falling apart. And I really enjoyed working with those clients, and it resonated with me because I've had anxiety myself for my entire life, which is manifested in different ways, but perfectionism being one of them. And so I felt like I could really kind of bring both the clinical experience, but also the personal experience into the therapy room and really help them.
Fantastic. So, perfectionism is a word that I, and I'm sure you and probably most therapists hear a lot from their clients. It's
Hmm.
certainly on people's minds when they come into the therapy room. And just for the benefit of the audience, if you had to sort of create this conglomeration of a basic client who had perfectionism type of tendencies, what types of things, if a person walked into your office for the first time, what types of things might you hear from them that lead you to believe, we're dealing with perfectionism?
Yeah, I would say they have a really hard time sort of celebrating their accomplishments, and it's always sort of on to the next thing. So, they will achieve something, they'll accomplish something, but they won't really sort of recognize that for what it is. And I think we'll also often like devalue that. I also see it show up a lot with procrastination. So there's this sort of polarized thinking where something has to be perfect or it's a failure. And so if the bar is set that high, there's just no way to attain that. And so people will just kind of continually procrastinate and engage in some avoidant behavior so that they don't complete the task or don't complete the task till the last minute.
Mhm.
um there's also just sort of this underlying anxiety, so maybe not being able to kind of pinpoint what feels off or what feels wrong, but there's this like low grade buzz all the time. A lot of difficulty relaxing, like they kind of constantly feel the need to be productive. Trying to think of what else would sort of categorize those folks. Yeah, I'd say that's sort of the gist of it.
Okay. So,
Yeah.
one of the things in there, about the failure, it's sort of a soapbox issue for me in a way. And here's what I mean by that. For me, I'm the type of person that loves to try new things and loves to explore things. And so what I learned early on was, obviously when you're trying something new, chances of you getting it right the first time are pretty much non-existent.
Right.
Um, and as I thought more about it and then got into the therapy field, I realized, you know what, it's really just it's a fallacy, this failure thing, because what failure
Mhm.
is learning. And I
Mhm.
use the example with clients all the time. When you first wanted to learn how to ride a bike, did you really think you were going to get up on the bike and just ride? Or did you
Mhm.
expect that you were going to fall a couple times till you got your balance and then eventually you learned how to ride the bike?
Mhm.
And I say, failure is the person who gets on the bike the first time, falls, and then stops.
Yeah.
Other than that, it's called learning, because you
Mhm.
you have to make the mistakes to figure out how to do it better, how to get to the goal you want to get to, and then eventually you achieve the goal. So now you've succeeded. So there is
Mhm.
no such thing as failure the way that we tend to talk about it. It's learning.
Mhm.
Only failure when you stop, you don't learn, and you don't, continue. And
Mhm.
that's not really failure. That's more of a mental state of how you approach things, and you can still succeed if you choose to go forward. So, this, and I even see it in the workplace a lot, where people are afraid, oh my gosh, I don't want to try that because I'm going to fail. Well, if you don't try it, then you're never going to do anything new. We're never
Mhm.
going to succeed with anything different. And, we'll still be sitting there using, typewriters because
Right.
I was afraid I might mess up the computer.
Mhm. Right.
So just curious for your take on failure. How do you view it?
Yeah, I completely agree that the real failure is if you either don't do anything at all or you do something and then you don't try again because there's this perception of failure. As you were talking, it reminded me a lot of Carol Dweck's work where she talks about the fixed mindset and the growth mindset, right? And if we have a fixed mindset, we kind of feel like we have like everything is fixed and unchanging, and what we have is kind of all that we get. And if we have certain abilities or talents or whatnot, that those can't necessarily be expanded upon. Whereas what you're talking about is more growth centered, and it is truly about the learning process and getting better over time. And that's just kind of part of the human experience. But I think people get so stuck in this either or thinking, and I see the perfectionism showing up a lot in interpersonal dynamics too, where people tend to be like overly accommodating. They're people pleasers. They have this fear of disappointing others. They sort of want to be this perfect person, without any needs of their own, which is just unrealistic.
Mhm. And then we wonder why those people are stressed out. What
Yeah,
are
right, right.
so so this is a great sort of background on this type of work. So, I know we learn a lot through stories and actual experiences. And I'm wondering, do you have any particular experiences that you've done in your practice with different clients or things? No personal information, but in
Mhm.
general, do you have some stories that you could share with us about what does it look like for a typical client to come in day one? They're anxious, they're worried about being perfect, they got all these things going on. Maybe they're doing some other things to try to address that's not working for them. What does a
Mhm.
typical client look like? What type of behaviors might they be doing? And then what do you do to help them?
Yeah, so I think most of the clients that come in, they kind of know that something has needed to change for a while, but it's not really, doesn't seem big enough that they have like taken action yet. And so when they come to me, it's usually because something has happened that has sort of propelled them into the therapy space. Like they're recognizing, okay, I this is kind of getting serious. I need to make a change, if I want to kind of be content in life and not be bogged down by this stress and anxiety all the time. So, one former client that comes to mind came in, very high performing at work, but was just kind of riddled with anxiety and some comorbid depression that was presenting as a lot of perfectionistic behaviors. So he was doing a lot of avoidance coping, which I think is super common for people. And what I mean by that is, instead, like the emotions feel so overwhelming that we really do anything we can to kind of numb out or escape or not have to really confront them, because it's a scary thing to confront those emotions for a lot of people. So he was doing things like overworking, just kind of just diving into work and only focusing on that. There was some drinking going on, just a lot of kind of avoidance of emotion in general. And so what we did in our work together was kind of trace that back to some of his earlier experiences, from childhood all the way up through adulthood, and some of the shame that he was experiencing about some past transgressions that had occurred, that was really kind of um really taking a toll on his self-worth and his perception of himself. And so, we worked to get together for about a year, and throughout that time we really worked on changing his relationship with himself and his perception of himself, which in turn allowed him to kind of make those other changes in his life. So he was able to, I mean, not only did his mood improve and his anxiety lessen, but he was also kind of able to set limits for himself in terms of knowing when to call it quits with work, not overextending himself. He was able to make more time to do the things that he really enjoyed doing, and had sort of this newfound appreciation for those. He really took a step back from social media. That was another avoidance technique, was getting on Twitter a lot. Really took a step back from that, really kind of reined in his drinking, where he was barely drinking at all, and just overall felt a lot less stressed and just a greater sense of contentment with his life. So I would say
Fantastic.
that's kind of a good example of the progression of treatment there.
Right, right. That sounds fantastic. So, So, one of the things that I'm thinking about as we're talking about this is I know you said part of your client base is professionals, and part of my client base is professionals. Being a former attorney, I tend to work with a good number of attorneys just because
Hmm.
we have that in common. And when you get into the anxiety issues, specifically now I'm talking about attorneys, the the young attorneys come out of law school, they get what is and what they perceive as a great job. They're being
Hmm.
paid well and it's interesting, high level work. The problem is the downside is it's a tremendous amount of work, and
Yeah.
what's expected of them is highly unreasonable hours that they have to put in. And so they get to this point that they are completely stressed out. They're working
Hmm.
all the time. They have no personal life. They feel guilty about going home to take a nap because I should
Hmm.
be, billing more hours. Um, have you had clients like that? And if you have, how do you help someone like that? Because they've got these, two different pressures. One, they want to be healthy, but the other is, but I got to succeed at work.
Yeah, absolutely. And I come from a family of attorneys. My dad's an attorney, my brother is an attorney. And I have had several clients who are attorneys. There's one that comes to mind in particular. And it's so hard in big law, especially, right? Because there are just sort of these unrealistic expectations on how many hours you're going to bill, or how available you are, to respond to calls or emails. So um it's a struggle, like when there are so many sort of systemic issues in place. You're working against a beast, right? It's not just you anymore. It's like all of these outside factors. So what I've been working on with her in particular, the one that comes to mind, is really identifying what her values are. So, a lot of times when we feel stressed or anxious, or like something is off internally, it's because we aren't living in alignment with our values and what we feel is most important in life. And so really kind of coming back to that, and maybe it means making modifications to make your job um be healthier by setting boundaries is a big thing, kind of scheduling in self-care, because you're not going to do it otherwise if you wait for there to be a good time. I'm a big proponent of like scheduling that into your day. And even if it's just small stuff, even if it's like a 5-minute meditation or something in the middle of the day, or going for a 10-minute walk outside, it can be anything. But I think that it's especially challenging for attorneys because they just have these systems working against them. And I think it's a lot easier for the newbies who are going into these positions, to really be clear about what your boundaries are from the get-go, because it's a lot harder to change expectations of you once you're 5 years in. Like if the partners have this idea that you're the go-to person to get work done and you're going to respond at 11 p.m., then it's really hard to break that cycle. But if you're just starting out, just to be clear, like, okay, this, of course, stuff comes up, life happens, there are emergencies, but this is the time that I'm kind of shutting things off for the night, and the rest is my evening to decompress and unwind. There really have to be clear boundaries between work life and personal life. And I think the pandemic has really kind of thrown a wrench into that for a lot of people with working from home and stuff. So, but it's just so important. It's so important.
Yeah. Yeah. It's, um, as you were saying that, I was sort of thinking to myself, about similar conversations I've had with my patients. And, with the attorneys, especially the ones working in big law, for example, um, they're clearly highly stressed because the work is stressful and the environment
Hmm.
is stressful. And they have this like institutional guilt that if they, God forbid, should have dinner with their family or go to their kids' school play or something, that they're not pulling their weight at work. They should be
Hmm.
building instead. And one of the conversations that I tend to have with all of them is I say, so let's look at the people, you're in the beginning of your career. Let's look at the people that are higher in their career and the ones that you're kind of on that ladder to get to. And let's talk about those people. And when we start talking about those people, they'll say, oh, well, there's this person and that person and whatever. Okay, so let's explore. How many of these people are divorced? Pretty much all of them. How many of these people are healthy versus overweight? Well, they're all pretty much unhealthy. How many of them are heart attacks? A good amount. And you just start going through this list and it's like, okay, so you're working really hard and striving to be unhealthy, divorced with a heart attack and a lot of money. Okay, if those are your
Hmm.
values, then we can certainly work with that. And then they
Right.
start to realize, you know what? Those aren't my values.
Hmm.
I don't like the fact that my kid is now 2 years old and I spent a sum total of 24 hours with them in 2 years.
Hmm.
So it comes down to, like you said, the boundaries and the personal choices and the values and all. Um,
Hmm.
One of the other things that you talked about a little earlier, and I think might be helpful for the audience, if maybe we did sort of a listing of them, is you were talking about things that people do when they have anxiety to avoid having to deal with it. And
Hmm.
I'm going to list off some of the ones, and then maybe you can help fill in the list with me. So we know people turn to alcohol is one.
Hmm.
We know they turn to marijuana is a big one
Hmm.
for my clients. Certain other types of drugs as well, depending on the
Yeah.
person. What other types of avoidance techniques do you typically see in people with anxiety?
Um, I think anything that is going to allow them to kind of escape or numb out. So any sort of like mindless activities. So it could be scrolling social media, it could be binge watching a TV show. I'm trying to think of what else. Like I said with my earlier example, just kind of diving into work and
Right.
using that to avoid confronting what might be the deeper issue or insecurity. Um, yeah, I like to distinguish between, like, I think people kind of can have this perception of like, oh well, I'm relaxing, I'm watching a TV show, but there's often, like I mentioned, sort of this buzz of anxiety still going on, or they feel like they have to be multitasking. So um I have another attorney that I work with who cannot just sit down and watch a TV show. He's either on his phone or he's doing work on his computer. And so we sort of like
Guilty.
we sort of trick ourselves into thinking we're relaxing sometimes, but it's not restorative. So with my clients, I really distinguish between um like what is sort of check out, avoidance, escapist self-care, so to speak, and what is actually restorative to like your mental, emotional, or physical energy. Like, and those things would be like exercise or meditation or doing something creative, cooking, like other things that you're really sort of immersed into the experience and you're not sort of passively just consuming whatever that is, social media, TV, things
Yeah.
like
Yeah. I have this, personal disdain for certain social media that I tell clients, absolutely, you may not go to these particular types of sites anymore
yeah.
or in treatment because they're just so toxic.
Yeah.
And it makes a big change even in 1 week. They try to stay
Hmm.
off of it. They may slip every once in a while, but it's different from being on it constantly throughout the day.
Hmm.
And some of it is just so toxic. It
Yeah.
really drags them
Yeah.
down.
Yeah,
um
and exacerbates a lot of what we're talking about, because then they're constantly making comparisons, even if they're not doing it consciously. Their subconscious is absolutely making comparisons and just sort of feeding that insecurity that's driving the perfectionism and anxiety in the first place. So it's just a vicious cycle.
Yeah, and that leads right into one of the other things that I see a lot, and I was curious whether you see it a lot, and it ties directly in to perfectionism in a way for me, but the number of people, it tends to be, not always, but it tends to be um, students who graduated college, went out, got their first job, they're getting acclimated to a workforce that they hadn't been in before, and then the feelings of the imposter syndrome
Mm,
and how that just holds them back, so because they're afraid to speak up at a meeting, or they're afraid to turn in a report because I'm not really that good, and so I'm afraid that it's going to show that I really don't know what I'm doing.
right.
Do you deal with that as well with your clients?
Oh, 100%. Yeah. Absolutely. Yeah. And I think what people don't realize is that it's so common. Like even a lot of celebrities, I was actually just reading a book, and last night they had a section on imposter syndrome, and how I think they named like Jodie Foster and Maya Angelou and like these big name people who are extremely successful, who have experienced imposter syndrome, even like when they're winning awards, or have written 12 books or whatnot. It's so common, and it's that little critical voice that all of us have. For some people it's a bit louder, and I think it's just important to know that everyone has been there. Everyone has started somewhere and have felt that way, and like you're probably judging yourself more than anyone else would be judging you.
Right.
uh,
Right.
yeah.
Yeah. I always remember when I was doing my internship, when I was learning, counseling, and I was working with, can't remember how old he was, late teen.
Hmm.
And he had a job that he recently got working as a cashier at a grocery store. And he literally had been in the job like 1 or 2 weeks. I can't remember exactly. And we were talking about anxiety and all these things. And he was so down on himself. It's like, I don't think that I'm good for this job. And I said, well, why not? He says, well, you go in and all the other cashiers, people come through with all the different produce and stuff, and the other cashiers just type in the code and they know what, and they just get the stuff going. And every single piece of produce that comes to me, I got to sit there and I got to look up what the code is so I can put it in the cash register. And I don't know these things. I'm so stupid. I should know this stuff. Why don't I know this stuff? I'm like, you've been there less than 2 weeks,
Right.
and you're holding yourself accountable for knowing all the codes for people
Hmm.
that took years to memorize them. Uh,
Hmm.
but this was his thinking. He was thinking that he was a bad person. He wasn't capable,
Hmm.
not giving himself any credit for the fact that he had to learn some things.
Hmm. Yeah.
Hmm.
And I think so many people focus on what they're lacking, like where that gap is, versus looking, they're measuring. um this is a concept in the book The Gap and the Gain, which I recently read, where like a lot of times we measure where we are to where we want to be, and instead we need to sort of compare where we are to where we've come from. So in those 2 weeks of working at the grocery store, like what has he learned, as opposed to, okay, I don't know all these codes. And with new jobs, I tell people to give themselves at least 2 months for like that learning curve to subside. Like everyone feels anxious when they first start a new job, and there's a learning curve for everyone, and that's totally normal.
Yeah. Yeah. So tell me a little bit about, we've talked a lot about anxiety, but you had also mentioned, excuse me, depression and trauma and things. How do you see those presenting in clients that come to you? Are they comorbid? Are they separate? Tell me your experience.
Yeah, so I mean, a lot of people with anxiety do have comorbid depression, meaning that they they kind of are a tag team, right? Like one tends to be more prevalent at certain times, and then the other tends to be more prevalent at other times. The depressive symptoms being more, and this could also kind of pertain to burnout, but those symptoms being more kind of just unmotivated, hopeless, just that negative thinking pattern, um, just feelings of kind of worthlessness, or like they're just not good enough. And then the trauma piece, I've noticed that a lot of the clients I've worked with, if we once we start digging into their childhood, we really see that there's sort of this complex trauma piece. And just for the people out there who don't know what complex trauma is, it's basically, we think about trauma and post-traumatic stress disorder as being sort of like kind of like a one incident thing. So if someone has been to war, a lot of veterans or whatnot, they will have trauma from that. Complex trauma is more rooted in sort of attachment, and like having these repeated experiences through our lives in which our needs weren't met in some way. So maybe somebody had a highly critical parent, and just in growing up with that type of parent can be complex trauma. And I really feel like the word trauma is kind of overused these days, but I just want the listeners out there to kind of understand that even though they haven't experienced anything catastrophic that somebody else could point to and say like, oh yeah, you experienced a trauma, there, it's worth exploring kind of their childhood and their early experiences, just to see what has contributed to some of what they're experiencing now in present day.
Yeah, I can't tell you, that is such an important point. Um, so many times when I'm working with a client, I'll say to them, when I'm first getting to know them and we're first trying to kind of figure out what's going on, I'll say, well, I do want to spend a little bit of time talking about your childhood and kind of how you grew up. And for me, the reason I want to do that is exactly what you just described. I want to see, what did they learn in terms of how to react to certain things? What types of things did they deal with on a daily basis? And a typical answer I'll get is, well, we can talk about it, but I had a pretty normal childhood.
Oh yeah. Yeah.
And I'm like, okay, you had your childhood, you had nobody else's childhood. How do you know what a normal childhood is? You're assuming that your childhood was normal,
Mm-hmm.
but someone else may have had a childhood where they grew up with a different type of parenting style. Or maybe the ones where they grow up where the parents coped with life by drinking heavily. And so the
Mm-hmm.
kid grows up and learns that, oh, if you have a problem, the way you deal with it is you drink. That's normal. That's what we do.
Mm-hmm.
So there is no such thing as this normal childhood per se,
Mm-hmm.
because everyone's is different. And lo and behold, when we start to dig in, it's like, oh, did you realize why you react this way to this situation? And then they think back, it's like, oh no, I didn't ever think about it.
Mm-hmm.
So I love that part of it, because they're always like, oh, we don't need to do that because it was just normal. It's like,
Right.
yeah,
Yeah.
well, let's do it anyway.
Right. I love that. Whenever somebody says, "Oh yeah, my childhood was great," I'm like, okay, let's dig a little deeper. And I always do that in my first session with a new client. I do a pretty comprehensive psychosocial assessment where we dig into everything, in whatever we can in that hour. But a lot of it is just talking about like family dynamics and what those parenting styles looked like, and how things were, how emotions were treated and talked about, and things like that. So
Mhm.
yeah.
Yeah. So, and this is, one of the reasons why I like doing this podcast is because, you know, patients can see what's really going on behind the scenes, right?
Yeah.
This is what your therapist is actually thinking about and doing. There's a
Right.
reason that they're asking what they're asking, there's a
Hmm.
reason for their approach. So one other thing that I'd love to hit on just a little bit before we wrap up is you know, EMDR is
Hmm.
it's a treatment methodology that has been around for a while. Personally, I'm trained in it and I use it. And I understand you're also trained in EMDR.
Hmm.
And so I'm curious just to hear your perspective about EMDR. What do you think about it? When do you use it? What type of results do you see? Just give the clients a basic background about it.
Yeah, so I think EMDR can be useful to treat a lot of different things. I tend to like using it when a client has a history of complex trauma, and at the core of it, it's essentially identifying um, a negative belief that the client has sort of carried with them throughout their entire lives, and often something that they're not even aware of. Right, so we kind of do some digging around that, and identify some experiences in which that belief has sort of resonated. And then it's based on this idea that the brain can heal itself. So just like when we get a wound, a cut, as long as we keep it clean, and it will heal on its own. We don't really question that too much. And so with a lot of EMDR is different from talk therapy, which a lot of people are used to, because there isn't a ton of like verbal processing that goes on. It's sort of trusting that the brain is gonna know what to do. And I like to describe it to clients as like we have these sort of two neural networks, right? One is negative, one is positive, and a lot of times the negative neural network really covers up a lot of the positive neural network, and so we can't access a lot of those positive memories or emotions or beliefs. And so what EMDR does is it sort of allows the two networks to connect, so that a lot of the prior memories or experiences don't sting quite as much, and aren't quite as triggering. So it's not like it wipes out those memories. It just it makes them not as triggering, and sort of allows us to have more access to that positive neural network, or positive beliefs about ourselves. So it's pretty effective.
Yeah, no, I appreciate your explanation, and I've used it for a couple of years with just phenomenal results, things
Hmm.
that I didn't even expect. And I even tell my patients when I'm first describing it to them, it's going to potentially sound a little bit hokey or new wave
Right.
or something. I said, but and I said, I feel the same way when I hear about it, but I am going to tell you, I use it and the results have been phenomenal for many
Hmm.
clients. And I'm talking about clients who have gone their whole life struggling with prior traumatic experiences like you were describing that have impacted them, and it's been holding them back. It's been um you know keeping them from achieving who they could be.
Hmm.
And we will do, and I know it sounds crazy, but I can give you case after case after case. We will do one session of EMDR. When I say one session, I always do a dual session because I don't want to stop in the middle of processing. So it's a 2 hour
Yeah.
session.
Okay.
And the number of clients who go from being stuck their whole life to finally processing the thing that was kind of holding them back, and it's almost like being let free from
Hmm.
this chain or something. And you see it when it happens because you see it in their face and you see the change, and then you check in with them a week later and they're like, wow, I mean, that thing is just not bothering me anymore.
Hmm.
Whereas it used to be a part of every single therapy session. They would
Right.
always talk about it.
Mhm.
So I it's the strangest thing to me because, like
Mhm.
I said, it seems kind of hokey, but it works.
Yeah. Yeah. And a lot of the clients I work with are very like analytically minded. And so I give them a lot of data and, kind of the neuroscience behind it, and a lot of the just proof and research that it is effective. Because I agree, like when you when you hear about it, you're like, what is this thing? Like I'm moving my eyes back and forth, like what is this? Are you hypnotizing me? So I think just knowing the research and how effective it is helpful.
Yeah, yeah. Well, we're reaching the end of our time here, and I am so grateful that you took the time out of your schedule to join us and talk about these important issues today. Um,
Yeah.
can you share with the audience if somebody wanted to get in touch with you? So first off, you're licensed in Illinois or elsewhere?
Illinois, Michigan, Wisconsin, and Florida.
Okay.
Yeah.
So if somebody wanted to get in touch with you, how would they get in touch with you, and remind us of your YouTube channel again?
Yeah. So my website is catharticspacecounseling.com. That's my practice website. And there are buttons all over the place for people to schedule a free 15-minute video consultation, just so we can see if we'd be a good fit, and to make sure I can kind of help them with whatever goals they're trying to meet. And then my YouTube channel is really just to, similar to what you're doing, just to kind of provide people with information and some tools and tips, and um, all things related to anxiety. So the handle on YouTube is the anxiety therapist.
Fantastic. Well, again, thank you for taking the time. I really appreciate it. It sounds like
Yeah,
you're
thanks for
doing
having
great
me.
work. So hopefully, if you all are in the audience and watching this and you have some anxiety issues or anything related to what we've talked about today, I think, Kristen's knowledge speaks for itself. And I encourage you to reach out and give her a call. So thank you.